What if your body already knows how to heal from trauma? If you just learn to listen to it. Welcome to Bread Therapy. I'm a professional therapist and hobby baker, and today we're going over a somatic technique for healing from trauma and expanding your window of tolerance called pendulation. Pendulation is a technique from Peter Levine, a trauma expert and founder of somatic experiencing. So first, we'll dive into why it's helpful, and then go over a simple how-to. Essentially, pendulation trains your nervous system to move in and out of activated states. It's almost like practicing moving from dysregulation to regulation in order to better prepare you to do so in a moment of triggering or activation. It also begins to expand your window of tolerance, moving you little by little into states of activation, but moving back, or pendulating, to calm begins to build your confidence in your ability to not be swept up by those negative feelings, thoughts, or sensations. So this dysregulation can be defined as a state when the amount of distress is more powerful than our coping ability. So increasing your window of tolerance means increasing what you're able to cope with and how much distress you can handle or tolerate. So how to practice pendulation? First, we want to think of something calm or peaceful and notice what happens in our body. Going to a calm, safe place in your mind, whatever that may be, can be helpful as well. For example, for me, I can imagine being on Silver Beach in St. Joe, Michigan, because that was a vacation spot growing up that I have many positive memories with. And so this includes noticing all the sensations in your body that you associate with peace and calm, and your nervous system sensing safety. Once you're in that calm state, you want to remember that all of those feelings or sensations that come up. If you want to pause this video and take a few minutes to get there and stay there, feel free. Then, like a pendulum, we're going to swing or move into a smaller state of activation. So whatever that means for you, but letting yourself feel 10 to 20% of distress or discomfort. So that could be 10 to 20% of anxiety or recalling some sort of specific thought or memory that is distressing but not overwhelming, just uncomfortable enough that you notice the difference or the shift. So then let yourself feel that 10 to 20% distress and notice any sensations that come up. It could be a fast heart rate, tightness in the chest, heavy shoulders, etc. And again, you can pause this video and spend a minute or so tolerating and sitting in that distress. And then we pendulate or pendulum swing back to the calm. So return to those feelings of calm that you noticed in the first part. If needed, return in your mind to that calm, safe place, or simply think of calm and peace. Notice how easy or difficult or how long it takes to return to the calm. And this isn't good or bad, however long it takes, but simply noticing that as a reference for future pendulum swinging. Then we can repeat this process as many times as you like, touching on these things that are 10 to 20% distressing, or if you get to a point of feeling confident, you can increase. But coming up with memories or thoughts that might be in different tiers could be helpful, but to some extent, I think just allowing yourself to feel more of the sensations is a part of increasing the amount you handle. So with some practice, you might discover two things. One, it becomes easier and easier to return to the calm. The first time may take a bit, but the more you practice, the quicker you will understand the power you have to move your body back to calm and peaceful sensations. And two, the 10 to 20% distress may start to feel less problematic or uncomfortable because you've expanded your ability or window of tolerance. Those become slightly uncomfortable sensations rather than sensations that have the potential to trigger overwhelm. So I'd encourage you to give this a try and add it to your practice. And if you'd like to see how the power of imagination can help you work through trauma and traumatic memories, watch this video here.